Hey everybody, Dr. Rob here. I was reading an article on the gut-to-brain axis, something that my second book's going to be all about, and it really caught my attention. I thought it was an excellent article, and it really spoke to the ideas of the effects of probiotics on cognitive reactivity, mood, and sleep quality. The interesting thing about probiotics is it's probably number 3 on the list on purchase supplements. Number 1 would be fish oils, number 2 glucosamine, and now number 3 probiotics. So a lot of people talk about the probiotics. I want to go over what good probiotics can do, when to take them, and also when not to take them. Probiotics are not for everybody in a sick condition. So this study was very specific. It had 4 different genus, species, and strains. So genus, species, and strains are very unique to probiotics. What you want to do is you want to be very strain specific. It's sort of like the DNA in a dog. So when you look, you want to see genus, species, and strains, something like Lactobacillus acidophilus with a number. So Lactobacillus is genus, acidophilus is species, whatever number that they have, the strain is afterwards. That's really going to explain the properties of that probiotic. There's a plethora of probiotics to choose from. Some of the big choices in probiotics is you want a diversity in the probiotics. You always want to switch. The more diversity, the more you have a superpower in your gut. Probiotics are great for overall gut health. Probiotics actually communicate with your microbiota, which communicates with your brain, which communicates with your gut, which communicates with your brain. I like to call it the 3-way calling system. So there is this tremendous communication. So these probiotics are speaking with, creating this microbiota, which is communicating your brain to your gut to your brain. So here are the 3 probiotics that they did in the study. They did Lactobacillus fermentum, L. raminosus, L. plantarum, and bifidobacterium longum. So the raminosus has been around for a long period of time, really has shown in specific literature to help with mood. In addition, L. plantarum is great because L. plantarum helps with over 80 studies to show that it's been great for irritable bowel syndrome. In addition, B. bacterium longum has what we call a vagally mediated property. It really stimulates the vagus nerve, which is going to be one of the ways that the gut can communicate with the brain. So they picked 3 very stellar probiotics. And here are the positive effects within these probiotics. Number 1, they found a decreased depressive mood state within 4 weeks. It was 4 weeks. It was an MRI study. Different parts of the brain lit up. They found out that it decreased depression. So many people say they're depressed up here. Direct correlation between the gut and the brain, and especially for depression. 1 month. So think about that. You can change your mood, you can change your symptoms of depression within 4 weeks. In addition, it showed decreased anger, symptomology, and fatigue. Fatigue is one of the biggest things. It's one of the number 1 drivers to go to the doctor. Most Americans concern themselves with fatigue. One of the biggest reasons when people say fatigue is something's wrong or going on or unleveling in their gut bacteria. With that being said, it's 2 months. Within 2 months, these people taking these probiotics decreased anger and their general fatigue had decreased precipitously. So it's very exciting to see, just from taking a probiotic, the different things that you can do and how it can change, personality traits, if you will. Additionally, increased sleep quality. Now, sleep matters. Sleep may be the missing link to functional medicine. Sleep is an interesting thing because we all need it, because without sleep, we're not going to recover. We're not going to perform. We're not going to have consolidation of our memories. We're not going to show any kind of cognitive acuteness. It's always much better to sleep the night before a test than to stay up like when you cram for finals or anything like that. So sleep is a critical element. There's nothing I can do as a doctor who sees patients virtually every day if that patient doesn't get ample rest. You're not going to heal. So sleep is important. And that was 11 weeks increased sleep. And they use what they call the Pittsburgh Sleep Quality Test. We use that in the office. Outstanding test. So when you look at what they did, the positives to the probiotics just here, not even in digestion, we found out that it was a decreased depressive mood. We also found out decreased anger and increased energy because they decreased the fatigue. Sleep quality improved. all things that are attributed to outstanding outcomes in lifestyle. Gonna flip this over and get to some more interesting things, in that the gut-to-brain axis truly involves three things. We all think the gut-to-brain axis involves maybe one, like neuronal, and it speaks the gut-to-brain axis neuronally through the vagus nerve. Now, if you all know me, we talk about the vagus nerve all the time. Vagus nerve, largest parasympathetic nerve, cranial nerve, number 10. Vagus nerve is the bidirectional communicator between the gut and the brain and the brain and the gut. It speaks to the brain within a millisecond. It is really quick. So you saw that these probiotics are ingested and they go to the gut. The vagus nerve goes from the medulla oblongata down through into the transverse colon. It attaches on the outside of the transverse colon. By attaching on the outside of the transverse colon, it senses what's going on inside the gut. So inside the gut, it's called afferent or sensory. It determines good or bad bacteria, and it determines the kind of neuronal feed it needs to give to the brain. So once again, it's a three-way calling. The microbiota, to the gut, to the brain. One of the ways that it's able to do it is through the vagus nerve and neuronal impulses. Now we also have endocrine. Endocrine talks to hormones, or if you will, they're specific neurotransmitters. The bulk of the neurotransmitters, over 90% of your neurotransmitters, are in your gut. Three come to mind. Number one, serotonin. 93% of serotonin is produced in your gut. GABA. GABA is your chief inhibitory neurotransmitter. So GABA comes from the gut and also speaks to the brain. And finally, the third one is Bdnf, brain-derived neurotrophic factors. And I want to circle that one. Bdnf comes from the gut, goes to the hippocampus. Brain-derived neurotrophic factors are a critical element to allow for brain neurogenesis. When I mean brain neurogenesis, is the ability of the brain to grow nerves. So you can grow nerves back. And one of the best ways to do it is to help your gut. So any kind of brain problem, any kind of personality, anger, depression, it really goes into your gut. It really communicates your gut with your brain. This literature, this came out on March 27th of Frontiers, really shows that there's a direct correlation. And of course, your immune system. Your immune system, 80% of your immune cells are in your gut. So keeping your gut healthy with good quality probiotics is a big thumbs up to leading you down a path of fighting off colds and specific issues that pertain to the gut, like IBS, celiac, leaky gut, and the like. The microbiome is a critical role, as I said, bidirectional. So when do you take it? Now, most people take it arbitrarily. Don't take it with yogurt, not enough. So you need colony-forming units in the billions. And one of the key elements when you look at these colony-forming units in the gut is that you want it at the time of expiration. Certainly at the time of putting it on a shelf is one, but time of expiration is even better. You're looking for in the billions. You're looking from anywhere from 5 to 20 billion colony-forming units. There's a few million in yogurt, and yogurt is dairy. Dairy is adverse to overall gut health. Yogurt has sugar, so don't take it like that. In addition, most people just arbitrarily take probiotics. The problem with that is if you've got a gut issue and your gut is too permeable and bacteria can pass your gut, even if it's a good probiotic, it will pass your gut and start the autoimmune process. So you've got to heal and seal your gut before you take probiotics. So if you have a leaky gut or a tear in the intestinal barrier, because you may have celiac and Crohn's and things of that nature, probiotics aren't the choice. When they are the choice is when that's fixed. And a great choice with a probiotic, which they didn't do in this study, and you'll get a better outcome, a little twist for you, is to take it with an omega-3 fish oil. So the omega-3 fish oil with the probiotic enables a better outcome because the fish oil patches and sticks to the intestinal tract, so the probiotic stays there. So it's fertilizing the gut so you have more, and then it's protected. So that's a little twist. You want an omega-3 fatty acid, you want 1 to 2 grams. Probiotic, I saw you raise your hand. That's a perfect time. Do you have a question or shout out?
Yes, so they want to know how much probiotics should they take?
Yeah, anywhere between 5 and 20 colony-forming units. So that's the amount. It's also which ones are right for you. So Lactobacillus acidophilus, Bifidobacterium longus, they're really big. L. plantarum, the B longum is a great one. Bacillus subtilis is a great one. there's a lot of different genus, species, and strains that we recommend. You always want to switch every few months because you want the diversity. Because the diversity you can pick from the cherry tree. In addition to that, exercise enables you to have better gut diversity.